Today I want to talk particularly about one of my passions and how did that passion come to be. I'm passionate about empowering people and particularly empowering elders to find choices that will allow them to age the best that they can. Now, what I do, a lot of people know that I'm a geriatrician, a clinician, how I do it very comprehensively, and so on and so forth. And everybody always asks me, why? Why that? Why that passion? And I have been digging, and that's when I thank the universe for all the years that I have. That means that I'm getting just older, because finally I was able to remember a little story that I'm going to tell you. When I was 8 years old, my parents, after separating, coming back together, divorcing, remarrying, and so on and so forth, just in my first 8 years, they decided to divorce, finally, again, for the second time. And they came to face me to unfold the news to me. Fantastic, of course. I was totally shocked. But let me give you a caveat so that you can understand what is behind. When growing up through those 8 years, I realized that I had my mom, who I love, the disciplinarian parent, very strict. Then my father, my hero, very permissive. That's why my hero was, and very laid back. Okay, so going back to the moment when they are unfolding the news of the divorce, there is my mom facing me and asking me, okay, darling, who do you want to live with? I was terrified, not only shocked, because in my heart I wanted to live with my dad. But at that moment, I felt totally mortified that I was going to piss my mom off, make her mad, disappoint her, and without 1 second more, I said, with you, Mom. Those words and that decision chased me for many years. At that moment, I felt powerless and choiceless. And from that moment on, I think that something started brewing on me saying, 1, I will never feel that way again. And 2, I will help people not to feel this way. And then I set my life to empower people and help them to find the choices that will make their life better and happier. So that's a little bit the story of where that passion came from. And then there I were, empowering women and trying to find their voices or help them find their voices. And at some point, when being a geriatrician and an elder care specialist, I started empowering elders to find options and choices. Because let's face it, it's kind of about time that aging in America take a new steer. So if you are ready, buckle up. Because look at what is happening with our elders around. We don't have room for our elders. Eldership has disappeared. The most that we see is they are too slow, they are not as efficient as they used to be, they are not as productive as they used to be, they are not fit anymore in our youth-driven society. So I said, oh, these people need to be empowered, because the worst is when those elders that we don't see and that we relegate to a corner when they need care, either they stay isolated in their homes or they are placed in these very ornamented and well-decorated buildings without a soul and with no choices. So they, for me, needed to be empowered, given choices, so that they can age the best way that they can age and thrive and not only survive. Then I decided, well, how am I going to do that? Wonderful passion. Well, wonderful now. When I was 8, it was not that wonderful. But then how to do it? And I said, the best way is creating what I call sometimes a very comprehensive or 360 degrees assessment that will allow me to understand that human being as unique and individual, touching upon financial circumstances or assets, the legal aspects. But then what are the healthcare needs? What are the psychological, emotional, spiritual needs, desires, likes and dislikes? And with that assessment, I prepare a roadmap that will help these people to understand that they have choices and resources to then go and age well, and not only age. I will tell you a story quickly in closing. I had a friend who sent me an email like a month ago telling me, I have this wonderful judge, retired judge. I spent fabulous 2 hours with this woman, firecracker, who is living in a facility. She rented 2 apartments in the facility to have enough space. Why she left her house? Because she's becoming blind due to macular degeneration. And she said, there is no place for me to be independent. I said, wait a minute. Don't tell me that you don't have a choice. That breaks my heart. I did my assessment, have a wonderful fun time, 2 hours, gather all the information, send the report, and say, this is what you need. You need technology to monitor the safety. You need to have engagement in your community. You need a driver that does this and that and the other. Let's start training a guide dog for the blind so that it becomes your friend from now, so that it's there when you need it, and so on and so forth. Wonderful assessment, send it to her. A couple of weeks ago, I got this phone call. Say, Dr. Bersing, I'm back to life. I'm not done or gone. And you show me that I have choices. I'm still alive, and I still have a chance. That's what I do. Thank you so much for listening.